So greetings, everyone. Welcome. My name is Nahyeli Perpina. I'm one of the Culina Health dietitians specialized in GI nutrition. And today we are going to talk about maybe two of the most common and bothersome GI symptoms that we see in sessions, bloating and constipation. Because this is a bite-sized talk, we will mainly focus on how to face the challenges that the holiday can pose to those living with bloating and constipation. My hope is that you will leave this webinar today with tools that make you feel empowered and confident about navigating this holiday season. As I just said, for the sake of time, we will just quickly go over what is bloating and constipation, some of its common causes, and general nutrition and lifestyle recommendations. But we will focus most of our time on tips for the holidays, how to implement some of these recommendations during the season, and our Q&A. But just to get started, I have this question here, no right or wrong answer. What have you noticed that trigger or what triggers or situations make your GI symptoms worse, especially during the holidays? Feel free to answer in the chat. I just want to have a glimpse of what are the main challenges that you predict for this upcoming holiday. And even if you don't mind reading some of them, because I'm having trouble finding chat now.
Yeah, eating too much, eating foods I don't normally eat, fructans, lots of veggie platters, erratic eating, stress, changes in eating patterns. So scheduled types of food, eating less fiber.
Okay.
There's some specific food items, mashed potatoes, celery. Yeah.
Okay, so fairly common triggers and situations that we see in session quite a bit. So hopefully you will find the information in the webinar useful to navigate those challenges that you're mentioning in the chat. So first, let's talk about what is bloating and how does it feel. Bloating is the feeling of tightness, pressure, or fullness in your belly. It may or may not be accompanied by a visibly distended abdomen, and it can range from mildly uncomfortable to severely painful. Between 10 to 25% of otherwise healthy people complain of occasional bloating, and around 50% of people that experience bloating also report a distended abdomen. Sometimes a distended abdomen as severe as needing different pant sizes, for example. So this is a fairly common complaint that we see frequently in session that may be or not accompanied by a clinical diagnosis. Constipation, on the other side, occurs when you have less frequent bowel movements than usual, typically fewer than 3 bowel movements per week. However, bowel regularity looks very different for everyone, so only you know what is normal for you. And that's why an individualized approach to these types of symptoms is very important. Constipation may consist of stool that is hard, dry, lumpy, and difficult or painful to pass. It can also present as a sensation of incomplete emptying of your bowels. Common causes of bloating and constipation. As you can see, there are a wider range of causes or things that could either cause or aggravate these symptoms. And it can go anywhere from digestive issues like the ones that you see in the slide, inflammatory bowel disease, enzyme deficiencies, issues with your GI motility, visceral hypersensitivity, which is the umbrella where IBS will fall under, celiac disease, dysbiosis, and I'm sure, and many more that for the sake of space, I didn't add. Then you have nutrition and lifestyle issues like eating too much and too fast, drinking carbonated beverages, food sensitivities, food intolerances, dehydration, sedentary lifestyle, inconsistent fiber intake. And then there are other things like aerophagia, which means that you swallow a lot of air This would be true for some people that snore or use a CPAP machine at night, or people that breathe through the mouth a lot, maybe because of a nasal blockage or because of seasonal allergies. Then there are hormonal fluctuations that can cause or aggravate bloating and constipation, like those that happen on thyroid issues, during pregnancy, during menopause. There are also endometriosis, pelvic floor dysfunctions, some medications that can also cause or aggravate these symptoms. Stress and anxiety is a big one, and spinal cord injury or other neurological conditions. So because of the widely multifactorial nature of GI symptoms, it is very important to approach them from a multidisciplinary lens to ensure that every foundational aspect of gut health is being addressed. In this slide, you will find many evidence-based recommendations that you could implement year-round. Many of these may sound familiar. Some of you may have tried some or many of the ones that are on the list, maybe on and off. Maybe you have incorporated some of these tips consistently into your lifestyle. You may have found relief of symptoms with what you have tried. You may have not found that it makes much of a difference. As you could see in the previous slide, that there are many factors that can be playing a role in how your gut is feeling. There is not a blanket set of recommendations that can fit everyone, and it is important to work with your medical provider and allied healthcare providers to help you find the strategies that will work for you the best. So now to the bulk of our topic, or the main course. Why GI symptoms may get worse during the holidays. That's a question that I've been getting constantly in all of my sessions for the past 2 months. The short answer to that would be changes in your routine, persistent stress, good and bad stress. Like during the holidays, not all the stress that you may be feeling is related to a bad source. I'm sorry. You may be feeling a good type of stress that's coming from your traveling plans, you looking forward to seeing your family or relatives, maybe some events that are coming up during the holidays. So bad and good stress can also be part of why your symptoms get worse during the holidays. Eating outside of home more and traveling. At the end of the day, if you think about these common causes of why your GI symptoms get worse during the holidays, all have a common denominator, which is you are pretty much facing the unpredictable and going out of your routine. Your gut really loves structure and routine. And this is pretty much what we will be focusing our tips down coming in the next slides about helping you get that structure to the best of your ability during the holiday times. So think about your gut health as a bucket. Everyone has a different size bucket at baseline, and the size of your bucket will be determined by things that you may not even be able to control. Genetics, other conditions like diabetes or thyroid issues, you may be pregnant, your schedule or your lifestyle, like the bucket may not be the same size for someone that is retired and may not have as many daily commitments and responsibilities than maybe someone that is working a full time and is also parenting. So those little things will determine or have a big impact on how big your gut health bucket is. So in this bucket is where your GI symptoms triggers will fit in for the day. Depending on how big or small your bucket is at baseline, it may determine how much you can tolerate GI triggers that come your way on the daily. And these GI triggers could be from environmental factors, from nutrition, from lifestyle, from stress, lack of sleep. If your bucket overflows, symptoms happen. There are things that make the size of your bucket change, just like I mentioned, like environmental factors, lack of sleep, inadequate fiber. So getting to learn about your bucket, what makes it smaller, what makes it bigger, will help you, will give you the power to make informed decisions about what to change on any given time to minimize your symptoms or flares. So one thing I like to talk a lot with my patients is, we need to get to learn your bucket and know what triggers you. So if you know that there will be, like maybe you're working on a project deadline and you're very busy and you know that you will have a hectic schedule and may not have a lot of time to have a consistent eating pattern, or may forget to drink enough water. So these are the times when you want to take actions on the things that you can control to keep your bucket a decent size so your symptoms don't flare up. So holidays on its own may be something that can shrink your bucket. So is when you want to focus on actionable steps that you can control to keep that bucket from shrinking as much as possible throughout the season. So this is the main objective of this holiday tip webinar. The holiday season is full of things that can potentially make your bucket smaller. So how can you minimize the chances from this bucket to shrinking and or even overflowing? Okay, so the first thing that we will talk about is sticking to your routine. These aspects that you see in this slide: hydration, sleep quantity and quality, balanced meals and consistent eating patterns, movement, which is different from exercise. Here we're talking about joyful movement. You don't really need to stress about going to the gym or keep a planned exercise routine, but just adding some joyful movement to your day to keep you physically active as much as possible during the season, and nervous system support and stress management. These aspects are foundational for gut health. Depending on where you are in your gut health journey, you may have already incorporated some or all of these to your lifestyle, or you may have not started or even thought about any of this. Wherever you are in the journey, these are important things to keep in mind during the holidays, and it will pay off if you decide to start or continuing working on at least some of these aspects in your daily routine. If there is just one thing you can take away from today, I wish it is to avoid the all and or nothing mindset. If you don't have an established routine that include any of these yet, pick a couple and start implementing them now to prepare you for the holidays. You don't need to have a perfect routine. You don't need to be to have experience perfecting each and every one of these aspects. Just identify which of these foundational things are more feasible for you based on your lifestyle, personality, a schedule, baseline routine. Choose 2 or 3 things to prioritize that you've noticed that have made the most impact on how you feel in the past, or pick what feels easier and less daunting for you to prioritize. A little consistency in the midst of so much change during the holidays can make a big difference on how you and your gut feels throughout the season. Manage what you can. As I mentioned before, there will be things that you can control and things that you cannot control that can make your bucket bigger or smaller. The ones that you see listed here are common things that you can control. And focusing on what you can control will lift a huge burden off your shoulders and minimize the stress and anxiety associated with them that are normally associated with triggering symptoms. So instead of focusing on, I don't know, how the weather is gonna be when you get there, if you're traveling to another state, or instead of focusing how Uncle Harry is gonna behave on the table, focusing on things that you can actually control throughout the holiday season will give you better results and will minimize the stress or anxiety and frustration that you may feel if you start focusing on things that you cannot control. So adequate hydration, consistent fiber intake. And when I say consistent fiber intake, is because we talk a lot about your diet may be low in fiber or your diet is high in fiber, but at the end of the day, if you cannot if you cannot make it to the recommended grams of fiber right now, try to keep it consistent. Having too low of a fiber intake one day and too much of a fiber intake the next day, it just sends mixed signals to your GI tract. It can cause bloating, it can exacerbate your bowel movement irregularities if you are going too low one day and too high the next. So trying to keep it consistent can help a lot as well. Even if you're not getting enough fiber in total as you should, just keeping it consistent will more likely minimize your symptoms. Avoiding trigger foods outside of holiday gatherings and events. And this goes back to knowing your bucket. Do you know what are the foods that normally trigger your symptoms? And because there will be so many other things happening during the holidays that make your bucket smaller, you really want to minimize the trigger foods that you know outside of holiday gatherings and events in order to keep your bucket on a good size for the rest of the season. Reducing GI irritants on your diet, like caffeine or alcohol or spicy foods, high fatty foods. Be present and intentional about your choices. You may know that alcohol is one of your triggers, but you may decide that you want to enjoy a little bit of alcohol during the season. So think about your bucket. Think about what other things may be going on that can make your bucket smaller, and prioritize. Maybe avoiding some other things that can shrink your bucket in order for you to be able to enjoy some alcohol in moderation. Understand your limits. And that pretty much ties up with what I just said about understanding your bucket and making informed decisions based on what triggers you. Acknowledge what you can't and try to find support. So you can communicate your needs. This is for the things that you cannot control. You cannot control what will be served for dinner. So ask about ingredients on certain dishes so you can know what you can and can't eat. Maybe you can request ingredient substitutions if possible. And if that's not possible, maybe you could bring a dish that is safe for you to have during dinner. Ask what restaurants you will be going, or provide restaurants recommendations that work best for you. Set boundaries. If you know like the mornings are not a great time for you to venture on outdoors activities, or if you need a morning routine to keep your bucket a healthy size for the rest of the day, request if activities can start at a later time if possible. If they want to support you, help them support you. Give them the resources and information to help support your needs during the holidays. And if they don't want to support you, then set boundaries. Decide if you want to partake on that morning activity, if you know that it's too early and mornings are not the best time for you to leave the home or for you to forego your routine. Bring your own resources as able. We will talk more about it in the next slide. And have backup plans. Be prepared. Think about things that make you feel safe. This will help reduce the stress load and keep your bucket from shrinking. Consider having snacks at hand, meal delivery services that maybe can be delivered to where you're going to be staying. Have over-the-counter medications or supplements that normally help you during a flare. Plan for events. Always have safe options. Requested, bring it yourself. Learn to make your favorite dishes with a safe twist. Have nutrient-dense snacks at the end of the slide. You will have a list of those. Check menus beforehand. Eat a snack before if you feel you won't have many options. Mindful eating. Eat slow, chew thoroughly, honor your hunger society cues, try smaller portions. You may be able to tolerate some of your food triggers if you eat less of them at one time. And after the holidays, reflect, reset, and rebalance. Give yourself grace and flexibility. You're doing the best you can. Focus on successes, even if they are small, and learn from the challenges and barriers you encounter during this holiday season to make changes in the upcoming year. And this is just a small list of how a dietitian can help you throughout your gut health journey. And the toolbox that I mentioned at the beginning. Here you will find some seasonings, sauces, snacks, and support items that throughout my experience with GI patients, I found that are very helpful. So I hope those are helpful for you as well.
Thank you, Nahyeli. I know we are coming up on time, but we do have time for a few questions. I am going to start with some of the questions from the chat here. The first question we have is, does sparkling water cause bloating? And is controlled hypothyroidism still a cause of bloating?
So a sparkling water, yes, it can cause bloating. As I said, not every trigger is a trigger for everyone. So we will have to see in like individualize if just carbonated beverage is what is causing your bloating. But definitely carbonated beverages, just you're drinking gas. So that's pretty much what you're doing with carbonated beverages, and that's the main reason behind it. If you're also drinking carbonated beverages that are sweetened with sugar alcohols or with high corn fructose syrup, then you're having double triggers there, because those two type of sweeteners are also common triggers for bloating, especially. So yes. And for control hypothyroidism, I'm not sure about it. My assumption would be maybe not, because if your hypothyroidism is controlled, that means that your hormones are within limits with the help of your medical treatment. But we will have to see what other things are going on in your diet and other lifestyle to know.
That makes sense. We have another question here that I think might be top of mind for many of our attendees today. How does alcohol impact my gut health?
So alcohol, if strictly speaking, alcohol is a toxin, right? So it does cause injury to your liver, which is part of your GI system. In terms of it's also acidic many times, depending on what type of alcohol beverage you decide to drink. So that can also be irritant to your GI tract. And if you are, for example, drinking things that there are some alcoholic beverages that have gluten. So if you have a gluten sensitivity or if you are celiac, you may find that that also can damage your GI tract. If you're drinking sweetened alcoholic beverages like cocktails, those are usually sweetened with sugar alcohols or high fructose corn syrup. So similarly to carbonated beverages, those are also triggers for your GI tract, especially because they affect your gut microbiome. So those just fast answer. for that one.
Great. Yeah, that's super helpful. And we actually have another webinar tomorrow that's specifically on mindful drinking and alcohol during the holidays. I am putting the registration link in the chat for anybody who is interested in diving more deeply into that particular topic tomorrow with us. I have another question here. We do have a few people joining from Fodzyme, one of our partners here, and they use the app. And they're wondering if one of our scopes of practice, like working with a registered dietitian, is to look at that app for recommendations in one-on-one sessions. Can you comment on that, Nahyeli?
To look at what? I'm sorry, I think I missed.
The FODMAP app. And
Oh, yes. So if you work with one of the GI specialized dietitians, yes, we do use the FODMAP app. I'm guessing they're most likely talking about the Monash app, which is the one that is most common, but there are others. So yes, we do use it. High FODMAPs being highly fermentable carbohydrates may be part of what's going on, but again, individualized approach, because there's just so much, as you could see on that slide, that can be happening. And as I said, the bucket size changes a lot, so it's kind of a learning curve to get to know your bucket, and the more you know your bucket, the more control you have over your symptoms, because your triggers can change, and they will change depending on what other things are going on outside. You may be susceptible to one or two FODMAP groups at one point and be less susceptible if you are more relaxed or if you are on vacation, things like that. So definitely individualized approach is key.
great. And we have one more question, which is a question about how, and if we have any tips on how to overcome bloating after fasting.
Well, okay. So fasting or prolonged time not eating anything can exacerbate bloating. That's something that I just want to throw out there. So no surprise there if you feel more bloated than normal if you're fasting. Things that you could do. Some things that I recommend are some herbal teas can help relieve gas, like fennel tea, peppermint tea, if you don't get heartburn from peppermint. Peppermint pills like Ivy Guard can be helpful. If you feel that you get constantly bloated in after fasting, those may be things that you want to do on a like daily basis. Then there are other things, like there are some yoga poses that can help you relieve bloating, joyful movement, gentle walking, things like that.
One more question we have, Nahyeli, and this is something that we got a lot in the registrations. Can you talk a little bit about how supplements work and how should some people think about supplements in relation to bloating and constipation? Just general advice.
So there are a few supplements that are better researched, like for example, psyllium husk, hydrolyzed guar gum are very well researched to help with constipation. So those are types of fiber. Then there are other supplements that we may use on an individualized basis, like sometimes magnesium can help to relieve constipation. As I mentioned before, peppermint pills like the Ivy Guard can be useful. Fodzymes, which is a type of digestive enzyme, we may also use and see symptom relief when there is high FODMAP sensitivity involved. But to this day, there are very few supplements that have a strong research and evidence behind. So whenever we're going to choose supplements, we really want to like work with a dietitian or a healthcare provider before we decide on taking any random supplement to help with it.
That's very helpful. Thank you, Nahyeli. We are a little bit over time, so we are unfortunately going to have to end the webinar here. Thank you so much to everybody for coming and spending time with us. We hope it was very helpful for you, and we will be sending out the slides and recording as well as contact information for how to chat with us to learn more, get into more specifics about your symptoms and how we can help in an email after the webinar. Thank you so much. Enjoy the rest of your day.
Bye. Thank
Bye
you.
bye.